to those that are watching this on the replay. This is Nurse Choma, founder of Choosing Nursing over at choosingnursing.net. And today I'm going to be talking with you about how to learn medications. All right, what's the fastest way to learn the medications? You know, because there can be a lot of drugs to know when it comes to nursing school, when it comes to the NCLEX and etc. And like I said earlier, we're doing a pharmacology challenge. So what you want to do, a part of this challenge is that we also have like what you call a pharmacology guide. So this is a 10-page guide. And in the guide, I go over different topics that you need to be aware of. I go over some terms, and then I go over conversion values. There's a conversion table included in the guide. And then on top of that as well, you also receive email series of and this email series is going to be like just more information. So it's like an email course and a farm guide together, and it's free. So if you want to download the guide, if you want to get access to it, you're going to want to go to the website. Okay, so I know that pharmacology is a huge weak area for a lot of people, and trust me, I know what it's like. You know, I know it's not easy, it's challenging, but you know, with anything, it's possible to learn it, right, and to do well in it. And today I did bring some props and that kind of stuff to help you to better grasp it and learn it and that kind of stuff. So I'm looking forward to sharing this with you today. So a lot of times for many people, what I've noticed is that the biggest thing that people will do, one of the things that people will do when they're trying to learn pharmacology, let's say they're trying to prepare for it for the test or something, and what they'll often do is that they'll go through and they'll try to learn the drugs one at a time. And that takes so long, and that takes forever, and honestly you're going to miss a lot of information that way, because nobody can learn well, let me not say nobody, unless you're like really intelligent, but it's just more challenging. So what I found though is that there's actually three ways to learn the medications, and I'm going to talk about which way might be the best way for you depending on where you are, because the more personalized you make this experience, the more likely you'll pass your exam. Meaning that you don't want to do what everybody else is doing, you want to do what works for you, right? So here are the different ways, all right? And when you're listening to it, you want to either say, oh, that's what I'm doing right now and it's not working for me, or that's the one I want to do, that's better, I'm going to do that one instead. All right, so the first one, number one, is to learn them by their classifications. What are the pros and the cons to doing it this way? So the so classifications is pretty much, yesterday I talked about, okay, you have beta blockers, you have fluorokinolines, you have, calcium channel blockers, right? So these are different classifications, right? So you can learn them in that type of format, and then you kind of like what I call it like a tree. Then you move down the tree, so to speak, and then you identify what are the rationales for these classifications, what are the side effects for these classifications, and etc. So it kind of helps you. It really helps you to have a very stronger, like a wider knowledge base, and you're more likely to retain it because you're learning them. But you're learning multiple things and you're identifying what makes them specific. So the pro to learning it by the classifications is that it's actually most specific to the exam. Okay? It's very specific to the NCLEX exam, because the thing about it is that the exam, it likes to test you in terms of the groups of classifications, right? It likes to see if you understand that. If you can identify, okay, that all or that vasodilators have a dilating effect and it relaxes the vessels, right? It wants to see if you understand that like your hyperlipidemic agents, like your statin medications, right, that they not only lower the cholesterol levels, but they can decrease the potency if patients take it with grapefruit juice. You see what I mean? So it really just depends on it helps you to learn a more wider facet of the medications, and it stretches your knowledge base. And I recommend doing this type if you're somebody where you're more organized, you're like more detailed, you like I know that's how I am. You like things very organized, like things clean, and you want to be able to create like a really strong diagram. That's a good option. Okay, so learning them by their classification. That's the pro, is that it's very specific to the test. The con, though, is that it's not as easy to retain if you struggle with association. Meaning that, so like, and this is when you kind of want to be a little bit more hands-on with flashcards and that kind of stuff. But you know, like, the con though is that it's not something where you can always easily associate them. You know, so meaning that there's some drugs, it's obvious. Like when you hear the name, oh, vasodilators, they dilate so they relax. But then there's some drugs that you may not immediately know what it's for if you're not really good at identify a way that it connects. Like for example, aminoglycosides, when you hear that, it doesn't sound like anything. It doesn't make you think of anything unless you've seen it before. But it's associated with a group of antibiotics that are very potent. So you have to get really good at pretty much identifying what is the specific thing that is associated with this classification. That's what this looks like when it comes to learning the classifications. All right, so that's number one. The second type, which is what a lot of people do, and you never finish this way, you'll never get through everything, is learning by individual medications only. So that's where you're going to go through one at a time and learn the drugs. I'm going to show you really quickly a diagram where it's by individual drugs, all right? And this is actually, I think this is on the cheat sheet too. But pretty much though, what you're doing is that you're learning one drug at a time. You see how, okay, I have them organized: generic, brand name, what is it for, what's the route, and what is the side effects. So like it's organized, right, by individual drugs. This is going to take a long time. Now, now if you're somebody where you have a very good memory, then by all means, go ahead and do this. But if you have, like, let's say 6 weeks to take your exam, if you only have like 2 months to take your exam, then this is not going to be, you're not going to get everything in time. So, but if you have, like, let's say you have 5 months or 6 months, then by all means do this route. But if not, then this is not going to be, it's not ideal if you don't have much time. All right, it's not ideal if you don't have much time. All right, so that's one of the things. So the individual medications, let me share with you this one. The pro is that it's most accurate. All right, it's most, you try that? Yeah. I know, right? Yeah. All right, the pro is that it's actually the most accurate for the exam because you're learning, okay, because there is some drugs where it's only specific to that type of drug and not the whole classification. All right, so for example, let me give you a good example. Metformin is what? It's an oral hypoglycemic agent. It's a type of diabetic medication, but metformin specifically, the adverse effect is lactic acidosis, and that's specific to metformin, but that's not specific to all the oral hypoglycemic agents. See the difference? So that's why it can be more accurate, because you are identifying one drug that like what is the specific side effects for certain type of drugs. I would recommend doing that only for the most frequently tested meds. Then yeah, that makes sense. So meaning that you're going to learn the drugs by the classifications as the bulk of your studying, and then whatever drugs that are more frequently tested, those are the drugs that you're going to those are the ones you're going to learn more specific details. Like for example, you're going to see digoxin. That's a frequently tested med, right? Although it falls under a group of an inotropic agent, what's most specific to it is digoxin toxicity, which we talked about yesterday, with those type of side effects, right? So I would want to learn specific side effects related to digoxin toxicity. You see that? So that's what I mean. Okay, so that's one of the biggest things right there. So the thing about the individual, it's good because it's very accurate. You'll know the specific drug because there's some drugs that have separate side effects than other drugs in the group. But then the con, though, it takes forever. It takes forever. It takes a very long time to learn the drugs. You know, that's the con. All right, so let me see if I think I put an example on here. Oh, here we go. Here's another example. So aspirin is an NSAID, right? Aspirin is an NSAID, but it's the only NSAID. But it's only NSAID that's more associated with Rey syndrome than the other NSAIDs. See that? So that's why I would that's why if you are going to learn, that's why one thing I would recommend then is if you're going to learn the specific drugs, then just focus on the ones that are more frequently tested. The way that you'll know they're frequently tested, honestly, is that these are the drugs where we see the most frequent diagnoses, right? So a lot of patients, they have what? Pneumonia, they have CHF, they have AFib, they have heart failure, they have coronary artery disease. So identifying what are the drugs that those patients normally need, that is the frequently tested medications. Those are the medications that you see, those are the medications that match what is clinically frequent as far as in the clinical field here in the United States. All right, so that's why you gotta learn. Okay, what do we see a lot in the hospital? Because that's what we're gonna give. We see a lot of patients who have what? Blood pressure, hypertension. So frequently tested medications would be a lot of antihypertensive drugs. See what I mean? All right, so that's the second type. Number 3, the third type is to learn by the body systems. All right, this one you might like better. Okay, you're gonna learn pretty much cardiac drugs, which we're gonna do this today actually. Cardiac drugs, renal drugs, respiratory drugs. Right? So you're going to group the drugs based on the system that they match. What I will tell you is that this is probably the most ideal for repeat test takers. Because the thing about it is easier to associate body systems and medications. It's easier, it's a lot easier, especially if it's been a long time since you finished nursing school. It's a lot more quickly because what happens? When you hear the word cardiac, what do? You think of the heart. And because you think of the heart, now you start thinking of, okay, what's associated with the heart? Blood pressure, okay, the heart, the strength of the heart pumping, and then now you start thinking of drugs that treats that. See that? Or when you think of respiratory system, what do you think? You think of the lungs, right? You think of the lungs, you think of the nasal cavity. So now you start thinking of drugs that helps the lungs. All right, so I would recommend this type if, let's say, you're not somebody that you don't do well with, let's say if it's been a long time since you finished school, or if you, either it's been a long time or you're a repeat test taker. This is probably more ideal.